Good afternoon. Welcome to day 262 at the EMA office where we bring you the latest numbers on the COVID. Joined here today with Chairman Kern and Barb Holt from the Health Department. Barb, you have the numbers again today.
I do, gentlemen. Good afternoon, everyone. St. Clair County totals, we'll start out with those. We've tested 158,686 to date. That is an increase of 1,539. And of those, we had 197 positive. Those include males and females under the age of 10 all the way into their 80s. So that makes our county daily positivity rate come down just a little to 12.8%. So that makes a total positives in the county since the beginning of testing back when it started in February and March to 14,980, with negatives being a total of 143,706. We're very, very sad to report we have 4 additional deaths to report today in St. Clair County. We had a female in her 60s, a female in her 90s, a male in his 90s, and a female in her 100s, all with unknown health conditions, and that brings our death total COVID-related in St. Clair County to 254. Again, our deepest sympathy goes to all those family and family members and friends of those that have passed away in St. Clair County due to COVID-related illness. We have a total of 12,376 folks that have completed their 10-day isolation period. Statewide, we have tested 10,497,998, and of those, 726,304 were positive. That makes an increase from yesterday to 6,190. Unfortunately, we also have several deaths to report statewide at 85, for a total death rate in St. Clair County, in the state of 12,278 deaths. Again, our thoughts and prayers to all of those families. Hospitalization numbers in St. Clair County. St. Clair County Hospitals, 97 are in the hospital due to COVID-related illness, and 7 of those patients are on ventilators. Region-wide, in Region 4, we have 229 patients on ventilators, 229 patients in the hospital, with 25 of those patients on ventilators. For our long-term care and congregate settings, the updates for those, we have 4 additional cases at the Cambridge House in O'Fallon for a total of 18 cases and no deaths. We have 3 additional cases at the Caseyville Nursing Home and Rehab for a total of 112 cases and 2 deaths. At the Cedar Ridge in Lebanon, we have 5 additional cases and unfortunately 1 additional death for a total of 135 cases and 17 deaths. Integrity Healthcare in Belleville, we have an additional 4 cases for a total of 49 cases and no deaths. And at the Marquay Nursing and Rehab, we have 1 death to report for a total of 30 cases and 3 deaths. Again, we have testing available every day, 8 to 4 at the Jackie Joyner Kersey Center. Several other sites throughout the county at Walgreens and different pharmacies, as well as this Friday, December 4th, we'll be at the Clair Fairgrounds. This is from 10 to 12 and from 1 to 4. This is a walk-up clinic. And yes, that is walk-up on Friday, 10 to 12 and 1 to 4. And then on next week, Tuesday, December 8th and December 9th, 8 to 4 at McKendree University, and that is both a walk-up and a drive-through. Again, you can find more of information on local testing sites on our Health Department website and our EMA website. And with that, Chairman, I will turn it over to you, sir.
Thank you, Barb. Let's take a look at the zip codes in St. Clair County. These are the COVID positive numbers, and these St. Clair County zip codes. In 62201, we're up 8 today to 383. 62203 up 6 to 389. 62204 up 1 to 242. 62205 up 5 to 378. 62206 up 9 to 737. 62207 up 6 to 378. 62208 up 21 to 866. 62220 up 4 to 1,039. 62221 up 19 to 1,406. 62223 up 7 to 923. 62225 up 1 to 75. 62226 up 35 to 1,605. 62232 up 3 to 486. 62239 up 2 to 216. 62243 up 4 to 307. 62254 up 5 to 497. 62257 up 1 to 127. 62258 up 1 to 546. 62260 up 4 to 335. 62264 up 2 to 160. 62269 up 16 today to 1,526. 62282 up 1 to 33, and 62285 up 3 to 298. Daily county positivity, 12.8%. That's with 197 new positives, 1,539 tested. That brings our St. Clair County 7-day rolling average up to 14%, way high. The state also pegs our regional positivity today up, and it's also at 14%. That's derived by entering into the calculations. Bond County coming in at 2%, Clinton County at 13%, Madison 12.5%, Monroe 6.2%, Randolph 11.3%, St. Clair 10.8%, and Washington County at 18.2%. Numbers up there, Herb.
Numbers are up there, and one of the numbers that we talk about every day, out of the 197 new cases we had today, 94 of them under the age of 40 years of age. So it's an alarming statistic there. A couple of the comments on here, people are wanting to know the difference between patients with underlying health conditions and COVID. Why would they be listed? And we talk about this all the time. Just because, and Barb, you can expand on this, just because you have an underlying health condition doesn't mean you need to die. When you attract COVID, it wears your system out. Can you kind of expand on that? There's quite a few questions today on their comments.
Absolutely. Again, we may have high blood pressure, diabetes, other COPD, and other issues already, but we're fine. We're able to maintain it with medication and proper diet and so forth. But then you add in another illness like COVID to it, it just exasperates the whole your whole health system within your own body, so it only makes it worse. Same way as one of the things we've been telling and asking folks to please do is also get your flu shot, because again, we don't want both to have COVID as well as the flu and really put the pressure upon your system. So again, that's what the comorbidities means, or additional underlying health conditions, such as we said, blood pressure, could be obesity, other COPD or other health conditions, and then you just put more stress on your body.
Yeah, and last week we reported a patient, 40 years of age, who passed away. So, regardless, if you have COVID, it's bad. It's serious. 4 more deaths in the last 24 hours here in St. Clair County. I don't know what some people think. Statewide, 12,278 deaths statewide, and that keeps climbing. And when I see comments like that, we want to try to explain to people again that these numbers are real. This is serious. St. Louis. I watched the news conference from the mayor there today. The hospitals are just overwhelmed, and I talked with the CEO of BJC over here today. They're still concerned like they were last week. So we've got to do what we can to shut the fuel off of this, and the only way we do that is what we've been preaching for 262 days.
And the people with the pre-existing conditions, the elderly, those are the people that we really need to be careful when we're around. And so wearing these masks really serves, if they're wearing the mask also, both of us wearing the mask serves to protect those people who are more vulnerable to COVID. They're just by virtue of the fact of the way their systems are, they are more vulnerable. And they're ones that need to be taken special precautions with, which is why we talk about those, those pre-existing conditions. And they aren't uncommon, Diabetes is not an uncommon thing. And so make sure that if you have any of those conditions, you're taking extra precautions and wearing these masks, washing the hands and watching the social distance, staying home if you can, is really important. And as we said, let's get through December, let's get through January, let's really hold these numbers down and keep ourselves safe. And if we do that, these vaccines are out there, they're going to be rolling out, and eventually we all get through this together.
Yes, that's what we're striving for, and like I said, we continue to try to answer all of your concerns, your questions. That's what we're here for. We said for 262 days, we're trying to give you the most up-to-date current information that is available to us, and we will continue to do that. Just like answering those comments today, we'll try to answer all of them. Some people may not like what we say on our answers, but you're hearing it right from here, from the health department. And like I said, anybody who has underlying health conditions, which a lot of us do, does not mean that they should die. So I really don't want to hear that. I mean, I don't care if you're 40 years old, if you're whatever your age is, this COVID is serious. It does not mean that we need to die. We need to take care of our elderly, your loved ones. So let's just show that respect and compassion, and we'll get through this, as Chairman Kern said. We'll be back with Cindy and Daisy in just a few minutes to translate this into our Spanish communities, and we'll be back tomorrow for day 263. Have a good evening.
We must find a way to live with COVID-19 until a vaccine is ready. One proven thing we know is that masks do work. By wearing a mask, you can do your part to help your community by limiting the spread of the virus and thus helping our businesses remain open and our hospitals able to handle the capacity. To get through this virus, we must work together as a team, and you should do your part by wearing your mask, washing your hands, and watching your social distancing.